Bismillah ar-Rahman ar-Rahim. Assalamu alaikum. Today we are going to talk about a third episode of pediatric epilepsy series, and we will talk about how to diagnose seizure or epilepsy in clinical practice. Now, when a patient comes to me and the family tells me, we had an episode of seizure, or the pediatrician or one of our colleagues referred the patient to us for further evaluation for seizure. From my side as a pediatric neurologist or a child neurologist, we do the following format of evaluating this patient. First, you have to take a history. Remember, history and history and history. We ask the family about the details of the events. We ask the family if they have a video. If they have a video, that's awesome, because one picture worth 1,000 words, one video worth 1 million pictures. So that will be helping us big time. We make sure we ask if the patient, what exactly happened with him. Did he lose his consciousness? His eyes were open or closed? Was he drooling? Was he completely unresponsive? Was he having jerking all over? Or one part of his body was jerking? Did he lose sphincter control, pee or poop on himself? Did he go into deep sleep after that? Very important, we ask about the family history. Does anybody in your family has seizure? Okay, and you ask the mom and the dad, and I usually ask them, please, dig into more detail and see if anybody in your family has a seizure. Any recent injury to the brain, any history of injury to the brain in the past, what time usually his seizures happen, because there's specific type of seizure that happens only at night, and some of them during the day, and some of them happens all the time. Now, after I take the history, and if I feel his history is consistent with a seizure or is highly suggestive of seizure, okay, I go ahead and order for him an EEG. And EEG is to look at the brain wave activity to see if there's any electrical discharge, what type of discharge, which part of the brain is this discharge coming from, and also we order a brain MRI to look at the brain itself if there's any issue. Remember, the video has a sound and picture. So the sound is the EEG, and the picture is the MRI. So I have to have the EEG as well as the MRI to complete the picture. But remember, by the end of the day, the diagnosis of seizure is a clinical diagnosis. What does this mean? If I have a patient who is his clinical history and looks exactly and is consistent with seizure, and I do an EEG and this EEG is normal, that does not mean that the patient does not have a seizure, because by the end of the day we depend mainly on the signs and symptoms to diagnose the seizure. And the other way around, if I have patient who comes to me, for example, he has a history of headache, and an EEG was done for him for whatever reason, headache should not have an EEG done for it unless it is very specific, rare situation. But in general, 99% you don't need an EEG for headache, and the EEG is abnormal. And you ask the patient, did you ever lose your consciousness? Did you ever drool? Did you ever lose track of time? Did you ever go into deep sleep, unexplained tongue biting, unexplained loss of sphincter control? Anyone have anyone in your family so you having gelatin chronic seizure? And he say, no, I've never had this one, or I have never had any issue like this. Then this is not seizure, and whatever is in the EEG, either it is not read very well, or either it's an incidental finding, because the EEG, which is the brainwave test, 1% of the population might have an abnormal EEG, but they don't have a seizure. Remember, history, and history. The most important piece of information is what you take from the patient. I just got online consultation from Egypt 2 days ago, and the patient has been in 2 medication and she is not well controlled. And when I asked the mom, what is the episode? She told me she has a very bad headache, and she started crying, and she feels like, she is not feeling well. Okay, and I asked her about all the sign and symptom of seizure. She did not have any, but the EEG was done, and the EEG was read as abnormal. Most likely, is a misreading. It was not needed to start with because we are dealing with headache, and she was started on one medication, and she did not improve for seizure. Then a second medication, and she did not improve, and the mom was very surprised because I told her, you are putting her on seizure medication for a headache that has no relation with epilepsy. If I have a seizure, I do an EEG. If I don't have a seizure, I don't do an EEG. By the end of the day, I depend on the history, thorough history, by experienced physician, preferably child neurologist, well-trained child neurologist or pediatric neurologist, and this will be more than enough to diagnose a seizure. Imagine you are practicing in Somalia and there is no an EEG machine. EEG machine is not mandatory for me as a child neurology to practice. It is very helpful, and it's extremely helpful. By the end of the day, it's a clinical diagnosis. I hope this piece of information were very helpful for you guys, and please wait for me and in the next episode, and we will be talking about how do I treat epilepsy, and also what are the medication we're going to be using for specific type of epilepsy. Dr. Hamza Alsayouf, consultant child neurologist. If you like me, give me like. If you like the video, and subscribe to the channel to follow the upcoming video. Thank you and have a good day.